be it C-section or be it a vaginal delivery,
right,
it is taking a toll on your pelvic floor muscles. And you can be told 1,000 times, do your Kegels.
Mm-hmm.
Okay, how many of us actually did our Kegels? How many of us actually know how to properly do a Kegels?
Thank you. I don't think anyone does.
Welcome to MENO with Jacqueline Buckingham, the authority on menopause, peri-menopause, and wherever you are on the pause spectrum. I'm Jacqueline Buckingham, founder of MENO, and firm believer that menopause is status, not a sentence. If you're here, something in your body or your life is asking for your attention, and you're not meant to navigate that alone. In our first 2 seasons, we started this conversation, won an Anthem Award, and brought you the leading experts before they were on Oprah. Now we're raising the standard. Each week, I bring you the verified providers, menopause specialists, and authorities you need to understand what's happening in your body and what to do next. From the gold standard in HRT and the little pink pill for sexual desire, to the conversations no one else is having about relationships, identity, and mental health. This is the full picture of your health, because this stage of your life is not just about symptoms. This is about how you live, how you feel, and how to embrace it all, because you have arrived. Pausing or not, start here. This is MENO with Jacqueline Buckingham. I'm so proud to bring you this esteemed guest to our show. Known as the top female plastic surgeon in New York City, and for her empathetic and compassionate manner, Dr. Yael Halaas is a highly respected national expert in aesthetic medicine, hair restoration, and women's sexual health. In addition to being double board certified, Dr. Halaas is a key opinion leader and speaker for major aesthetic brands. She's also a clinical investigator for new treatments. She's the daughter of Cuban and Argentine parents, and she uses her multicultural background to welcome her international clientele to her world-class offices in New York City and Westchester. She's been featured on Fox News, Dr. Oz, NBC, and I'm thrilled to have her here on Clitorology. Her passion for technology that can help women is infectious. In the next hour, we cover a lot of ground and talk about everything from what to do about urge incontinence to how to have epic orgasms into your 90s. Yes, I did say 90s. Here is Dr. Halaas. You're such a renowned expert in the field, and I'm so happy that we're talking about women's sexual health with you.
I am delighted to be here, and as much as I know about technology, the fact that we can bring that technology to make women's sexual lives better, thrilled.
Okay, let's just jump into the technology then.
Okay.
Let's just jump right in. Let's talk about what is the technology. How is the technology able to help us feel better, maybe look better?
Live better.
Okay, I like it.
Yeah.
Let's go.
So listen, I'm full disclosure, I'm a board certified facial plastic surgeon, and I love technology, and I do a tremendous amount of technology research in my office. And what we discovered is using, whether it's laser, whether it's radio frequency, whether it's electromagnetic stimulation, all of the technologies that we were using to make our faces and necks look better. Mm-hmm. Where else could we apply that to get tightening, improve circulation, get tightening of tissues, and get a better result and a better way to live? Well, they looked south.
Perfect.
And amazingly, all of these technologies can really make a tremendous impact in how women not only look and feel about themselves, but also urinary incontinence, sexual satisfaction, and really just having a better life.
I love that. It really is about overall quality of life.
100%. And so what we see, to jump right into the specific technologies, what we see is that when we use radio frequency, whether we use CO2 laser, whether we use really in the US, the only FDA-approved chair we have is the Emsella.
Okay.
And when we use these technologies, a couple of different things that we're treating, and we're really making life better. So one of the biggest issues that we can see is after giving birth. It really takes a toll on a woman's body.
I mean, understandably, yes.
Of the year.
I've had 2, and yes, they have to get out some way.
They have to, yes. There's a point, I think, during pregnancy when you're like at the 8th month and you're like, wait a minute.
What's the exit strategy?
What's the exit strategy? So, be it C-section or be it a vaginal delivery,
Right.
it is taking a toll on your pelvic floor muscles. And you can be told 1,000 times, do your Kegels. Okay, how many of us actually did our Kegels? How many of us actually know how to properly do a Kegels?
Thank you. I don't think anyone does.
I'm going to agree with you, because when patients come to my office and they sit on the Emsella chair, all of a sudden we turn it on, they're like, oh. And I'm like, that's what a Kegels is. That's actually like 11,000 Kegels going on in 28 minutes.
Okay, so I'm going to pause really quickly. What is the Emsella chair, and where do I get one? When can I sit on one, and what's it going to do for me?
I'll see you tomorrow at just cross town on 56 and Park. So what is the Emsella? So the Emsella is basically a chair, and it looks sort of like it looks actually just like a blue kind of funky armchair.
Oh, okay.
Which is why several of my patients, when we have it in one of our exam rooms, when they come into the office, they're like, oh, I don't want to sit in the exam chair.
Yeah.
Like, let me sit in this armchair.
This cute little blue thing.
What is this blue thing here? What is this comfy wide blue chair? And it actually is one of the ways that the whole conversation gets started, because I'm like, well, if you're going to be sitting on that chair, this magical chair here, let me turn it on for you and show you what it really does, and how it can help your life, and what it's doing is it is giving pelvic floor muscle stimulation by using high intensity electromagnetic stimulation. And that is a relatively newer technology. I mean, in some forms it's been around for decades, but specifically from the company BTL, you guys might have heard about the Emsculpt, Emsculpt Neo, which also is using this high intensity electromagnetic stimulation to really depolarize, which means to get the entire muscle working in ways. We can go to the gym, we could do Kegels, we're never going to get that muscle 100% to act. And when we get that stronger contractions, we're building those muscles up. For the Emsculpt, we're making our body muscles stronger and better. For our core, which is so important post-pregnancy.
Absolutely.
It actually helps to bring back the abdominal muscles back together.
So the chair does that?
That is the Emsculpt.
Okay. Oh, the Emsculpt does that.
The chair.
Okay. How about the chair? So I'm your patient. I come in. I sit in the chair. And you're like, hey, do you want me to turn on the chair?
We're going to turn on the chair, and your pelvic floor muscles.
Am I still clothed, first of all?
You're completely clothed.
Okay. I'm listening. And I say yes. What happens next?
I'm going to turn the machine on.
All right. I'm
also going to take a little bit of history.
Sure.
Because with electromagnetic stimulation, we don't want you to have a cardiac implant, a metal implant. So there's one or two precautions we're going to take.
Okay.
All being good. I'm going to sit in the chair, turn the machine on, and you're going to feel right in the core of you, centered right where we need it to be.
Yeah.
If you need a hint, this is where we're centering it.
Yeah, there.
And you're going to feel different pulse waves causing contractions of your pelvic floor muscles.
So like an Uber Kegel, is that what it will feel like?
Uber Kegel, which is, by the way, not painful.
Okay.
But just maybe not something you felt before.
Okay. Does it feel good at all? Are we worried about that? Are we worried that
you are not going to have an orgasm sitting on the Emsella chair?
I'd be a little concerned. I would. I'd be like, this might change our relationship. I might need to get a new doctor now.
No, it's all good.
It doesn't hurt.
It doesn't
give
hurt.
Me an orgasm.
It doesn't give you an orgasm.
Perfect.
It is just Kegels contractions that you are thousands of them in 28 minutes that you would never be able to do at home. It is causing a supramaximal, like super strong contraction, engaging all of those pelvic floor muscles, which has a number of benefits.
Yeah.
It's going to tighten those muscles.
Yeah.
It's going to increase circulation to that area.
Love.
And because of those two things, it's going to decrease both stress or urge incontinence. That's a bad thing after you give birth. That can happen, or just with age.
Is that like you sneeze and you pee a little and you're like, oh my God?
That's stress incontinence.
All right.
And urge incontinence is, oh my God, I have an urge. Oh my God, I'm going to pee. Oh my gosh.
And
So-
you need it like 2 seconds ago.
And you needed it 2 seconds ago.
Got it.
So it can help with both of those. It also, let's give it a little shout out, can help for men too who have these issues.
Okay.
Yep.
Emsella, not just for ladies.
Not just for ladies.
Any parts are welcome.
Any parts are welcome because in that region, everyone maybe could use a little tightening and a little increased circulation.
So men can do Kegels.
Men perhaps could, depending on their activities, perhaps could use a little anal tightening.
Got it. Okay. Very good. Understood.
So that could be a benefit and increased circulation for them to have better erections.
Oh, all right.
Could
this is
be.
fun. So
it's
can you do his
good
and hers
for
sessions
both
like
of you?
like a
You absolutely
massage?
can. You absolutely can.
I like this.
And then they can go home together.
Oh, this
and
is so
engage
fun.
with any activity.
And do you feel it afterwards? Am I walking around kind of still feeling like I'm Kegling?
So you won't, once the pinching is stopped, you don't feel like you're still Kegling, but you will appreciate increased circulation in that area.
Okay.
Which brings me back to having more comfortable sex,
Got it.
particularly after menopause.
Yeah.
Things get a little drier, things get a little more painful. And because you're having really strong muscle contraction,
Yeah.
orgasms tend to be better.
Amazing.
And I'll share with you a little something.
Sure.
The reason this device became so popular in a facial plastic surgeon's office
Right.
is because my staff started sitting on the device.
Oh.
And they came back the next day reporting very interesting positive effects, particularly the ability to have a G-spot orgasm,
Love.
which they've never had before.
What?
And get ready for this,
I'm ready.
female ejaculatory orgasms, which they had never had before.
And this is amazing.
Life-changing.
Just from being on the chair one time?
Even one time, you will start to see benefits. The whole treatment schedule is supposed to be twice a week for 3 weeks, so a total of 6 treatments.
Okay. Okay, this is amazing. I mean, having that kind of feedback firsthand, I can absolutely understand the, wow, I've never had a G-spot orgasm. But the squirting is a whole other level.
It is absolutely a whole other level.
And so what do you attribute that to?
Again, having that increased circulation.
Yeah.
So intensity is going to improve and comfortability. But also, if you think about it, what is an orgasm? It's an intense muscle contraction
Right.
and then relaxation.
Right.
The better the contraction,
The better the orgasm.
the better the relaxation, the better the reward.
I love this.
I love technology.
I mean, that's incredible. And this is something that, the chair is in your office. How else would people know you as a facial plastic surgeon would know that you do this?
They know how much research I do in technology.
Yeah.
And we always have ongoing studies. So there's always kind of a tell me, doctor, what's new.
Okay.
But as a facial plastic surgeon, so much of my practice is the aging face.
Right.
And women in their 30s, in their 40s, and up are coming to me, and really we develop a bond. They really want to talk about how they can improve their lives.
Yeah.
And if the opportunity allows itself, and I do try to introduce, how can we help you in all ways.
Right.
This is the same generation. These are the same people who are starting to have issues with menopause. And that does come up because whether you have estrogen, what level your estrogen is going to affect the skin as well. So,
Yes. Yes.
so it does lend a hand. And I, much like yourself, do feel a mission to help other women.
Right.
And definitely for all of us to be empowered, living our best lives.
Right.
So much attention has been given to men and their sexual function as they age.
Could not agree more.
Why wouldn't it come up? And as we can see here talking together and in all of our prior conversations, we feel an obligation to help our fellow women and a comfortability to talk about what science and technology and medicine can do to help our lives. And I know I want that for all the women in my life.
I absolutely do. I'm, thinking about how normalized Viagra is. It's so normalized. We see the commercials. It's nothing, to be hush-hush about. It's just erectile dysfunction. Here's what you do. Talk to your doctor about it. If I'm, this man and I say, hey, here's my issue, no problem, I'll write you a prescription.
Absolutely.
Why is it that women's sexual health is not as much there?
Are they afraid of that we can orgasm more times than they can? I don't. We can ejaculate more than they can.
Yeah, is that what this is really about?
Is it about? Maybe it's a larger discussion. Is it about the power that women really have? Are they?
Yeah.
And it's actually kind of interesting when you look back on a more sociological perspective. Is there definitely were times usually not in Western civilization, that women's sexuality was actually something that was celebrated.
Yeah.
But we seem to be more containing it, and how can we hide it more, and how can we close it down more? But and even when you look at Western medicine, and I graduated Ivy League all the way, and I love my professors. How little to no attention was given. They didn't even know what the anatomy of the clitoris was. They thought it was, okay, that's this one dot that you have. Well, it's actually a larger organ with a lot more nerve endings and a lot larger than they had thought.
Yeah.
So it is a bias, unfortunately, that we do see throughout our medical schools. And the same also with menopause. There's so many questions that are unknown about menopause.
Right.
And all of us, we are looking more than gorgeous in our 50s and our 60s. And why shouldn't we still be having sex? Why should we be suffering with incontinence or a decrease in sexual satisfaction or even wanting to engage in sex because we gave birth? And all of these things have to be looked at together. It's the same when I'm treating somebody and I'm looking at someone's face and how can we make your face and neck better? It has to be a totally integrated approach, because the skin has to look as good as the volume. And honestly, this is some of the same issues that you see with female genitalia. Sometimes the labia are looking aged.
Okay.
And
all right.
You want that tissue to be, women should not be embarrassed by that tissue.
Sure.
You want that tissue also to be maybe looking a little tighter,
now,
a
is
little
that
fuller.
surgery, or is that vaginal rejuvenation, without surgery?
So there are a number of options.
Okay.
I have a fully accredited OR in my office, and some of the plastic surgeons are doing labiaplasties because you can perform surgery, but we can use back to technology where I spend so much of my office's time on doing research. Is we can use radio frequency in combination with the Emsella.
Okay.
So that radio frequency can target the labia tissue as well as the vaginal tissue.
Okay, that's interesting.
And can shrink the size and the appearance of the labia. So we should all be loving our lips wherever they are on our body.
Let's be loving our lips.
Love your lips.
Love your lips.
Here, there, everywhere.
Now, those little devices that you brought out that I saw before, is that how we treat them? Is it using those? I will grab them.
Let's talk about that.
Okay. All right. I've just grabbed these little devices for those of you who are not watching, but instead listening. And I'm going to go with, this is the size of a...
Yeah.
I don't know, a Japanese eggplant?
I was going to say, what does it bring to mind?
I'm going to go Japanese eggplant, and I'm going to go baby carrot? Large baby carrot.
Okay.
All right, so let's talk about what are these and where do they go and what are they normally attached to?
Yes, so this is this cylindrical long device.
Yes.
Comes in two sizes.
Yes.
And this is actually a MFEM 360 applicator. And this actually is inserted into the vagina. And again, there are two sizes. So there's a small and a smaller.
And that just depends on,
larger.
honestly, like the size
on the size for comfort.
Okay.
And then actually, sometimes with patients, they will start with the larger one because after giving birth, some of the tissues can be a little laxer. But as the treatments go on, they need to switch to the smaller one because they get the tissue tighter. And so what we're doing here is that 360 all the way around in nothing more than 8 minutes, and this is the MFEM that I'm describing, is releasing radio frequency energy, basically heat, which
so that actually gets inserted in the vagina.
This is inserted into the vagina.
About to where?
Depends on the length
all right.
of
Oh, okay.
patient.
To each
their own.
Yes.
Absolutely.
Got it.
And in just 8 minutes, 360 all the way around,
Okay.
radiofrequency energy is heating those tissues,
Okay.
increasing blood flow, which is what we need to create moisture. Another very important
Got
issue
it.
that
The
develops.
heat, the blood flow
Heat,
gives
blood
you the moisture.
Perfect. As well as stimulating collagen and elastin.
Yeah.
Just like we want on all of our skin.
Right. It's just the same as what we do
Just
to our
the
faces.
same.
I mean, really.
To have younger tissue.
Okay. Okay. Now, I'm at your office. I say, I want to book a session of the MFEM 360. I come in, and obviously I have to take my clothes off for this one.
For this one, unlike the Emsella,
Yeah.
you would be undressed.
Okay. And I mean, for anybody who's had like a vaginal ultrasound, that's what that kind of reminds me of.
Exactly,
there.
but even faster.
Even faster.
Yes.
And then do you kind of put it in there? Does the patient insert? Do I hold on to
No,
it? Do you hold on to it? Is it moving?
This is done by myself or one of our medical staff.
Okay.
Actually, we have a number of nurses in our office who are really dedicated to overall wellness.
Great.
And so it's inserted, and 8 minutes later, comfortable treatment, not an issue at all, which is an improvement because it used to be, we had earlier versions, Thermiva, Votiva, that take about 25 minutes to do a treatment.
And this is 8?
This is 8.
Oh my God, this is amazing.
Yes. So
I
there's
love that.
really no reason
Okay, so isn't
to
this...
not get treated.
No, I mean, absolutely not. This sounds like just like if I'm getting a facial and you're talking
Yes.
to the person who's doing your facial, and it's like, oh, okay, and here's what's going on and blah, blah, blah. And then it's over and you're like, this was so fun.
Yep.
Is that what's happening? Because your technician, your nurse is basically delivering the treatment. So
Exactly.
not like moving it around, but kind of holding it in place.
Yeah, there might be a little
bit of
bit.
movement.
There might be some movement. There may
Okay.
be some movement, and that, and particularly, I'm fortunate enough that I have really so many devices in my office.
Yeah.
But yeah, there are other companies,
Okay.
and so again, there are other treatments that take longer.
Okay.
In which case, and they do need, because it's not a 360 device, they do need to move to usually each quadrant.
Got it.
All to circumferentially to get all the way around.
So how many treatments do I need of this one?
So this treatment, we usually do 3.
3.
And you can do them 1 month apart.
Okay. Easy enough.
Yeah.
No pain, obviously.
No pain.
Doesn't feel weird.
Doesn't
Would
feel
I
weird.
have the possibility, like I did with the Emsella, of going home and having amazing orgasms?
Will absolutely improve sexual comfort and sexual satisfaction.
Okay.
You're not going to see the muscle stimulation.
Got it.
That you get with Emsella.
Okay.
So
this is more
that's radio
lubrication.
frequency, lubrication, which together with the building the pelvic floor muscles is really what's going to help to give us back
So I can do them both?
You do them both.
Oh, I love this.
Do them both.
Because 8 minutes, the other one's 28 minutes. We're out of there, right? Is that right?
Yeah,
28
you're
minutes?
under an hour, under 45 minutes, you've changed your life.
Okay, this is amazing.
Yes. And then this little guy
Okay,
here.
what's this one?
This little guy is what it can be used for the external tissues,
So the labia.
the labia. Exactly
Okay.
right.
Both inner and outer? Are we just talking about inner?
So no, this is for the labia majora and minora.
Oh, okay.
So you can do both. So there's no treatment.
So plumping,
Plumping,
shrinking,
tightening, lubricating.
tightening. Okay. Because some women I know have pain if the labia has gotten, I guess, too stretched out. Then it
Atrophied,
can be
yeah.
painful. Right, you can get kind of caught, and having vaginal
And
intercourse can be
Dry
uncomfortable.
and incredibly painful.
Yeah. Okay.
So
So this is what you'd absolutely go, we'll try this before you have surgery, for instance.
absolutely. And of course there really aren't surgeries to help lubrication.
I see.
There are surgeries to help with incontinence.
Okay.
And depending on the severity, surgery may be what you actually need.
Right.
But I think most patients, and it's true with the face as well, if they can do a treatment that is as benign as Kegels or like the Emsella, like they're going to prefer, everyone's going to prefer if they can do a little physical therapy
Sure.
before jumping to surgery.
Absolutely. I mean, without a doubt. Surgery is great, but I would want to try everything else before going there. Okay,
Absolutely.
so speaking of squirting,
Okay.
I love how when we first met, we went there within like 3 minutes. And immediately I knew I must have this woman on my podcast, because the way you introduced it, you told me about this book that you give to your patients, which I knew about and I'm grabbing.
Good. Yes. And actually that goes to show you that when you can discuss this, it was literally in 3 minutes.
Yes, it really was. I mean, it really was. It was like we got introduced, and within 3 minutes, we were talking about specifically chapter 3 and chapter 4 of this book, which, if you're not watching, is Female Ejaculation, the G-Spot, Not Your Mother's Orgasm book by Deborah Sundal. And it is a phenomenal book. It really is. It gets right in there. It just jumps right.
It gets right in there.
Right to it. And I like that because it doesn't, seriously, no pun intended. I can't believe I just thought of that. But I was like, doesn't beat around the bush. But I really like that it doesn't, because so many things, there's so many niceties that we've had to, pad around these things. Like, I like, just give me the answers. What is it? Why can I get it? Where can I get it? And, if I'm not someone who can ejaculate, then perhaps I can read this book and do it.
Yeah, absolutely. And I always tell my patients, I was like, listen, the first chapter is very interesting, talks about like the history of female sexuality, great. But then you can just jump right in if you want to just skip that. Chapter 2, 3, 4, halfway through 4, the rest of the book, optional. But yeah, because one, it's just really teaching women their own anatomy, which often they're not aware of.
Yeah.
And they may be afraid of, wait, I'm peeing. What is this? No, you're not.
Right.
It is something that all women can achieve.
Yeah.
Definitely technology, again, no pun intended, can make that better. But why not?
Why not?
And
so how does this book come up with your patients?
It was 3 minutes into our conversation. How do we jump in?
Well,
into
I don't
that?
know how we did, actually. I don't know how we did.
I was just on 2 days ago. I was at lunch, really with like 4 or 5 couples had gotten together. For our families were there, and within a few minutes, the women had kind of settled down, and we were kind of just talking together, and God bless, we started talking about it, but one of the women started talking about it. It's like that I can't go into a car and drive for more than an hour without having to pee.
Wow.
And then within 3 minutes, this book was already mentioned. And besides being able to improve that situation of the urinary incontinence, how much fuller everyone could be enjoying lives. And it's so interesting because as women, we're very comfortable talking about anything and everything.
Yeah.
But there's a few topics we never talk about.
So true.
And aging and how it's affecting our sexuality.
Yeah.
And also how aging affects, and honestly, our hair, which is another thing I end up talking a lot about with women.
Yes. Absolutely, our hair.
So you can, we talk about everything together. Well, like there's nothing that's off limits between women.
Right. But don't you feel like this whole topic of anything around female sexuality does get,
neglected,
clipped around even people who you might think would be more comfortable with it?
It was unbelievable because I was there with 5 intelligent women, homemakers, professional, every type of woman represented at that table. And so few had said, wait, there's something I can do about it?
Right.
Wait. What are you talking about?
Yeah.
And actually a G-spot orgasm? and ejaculation, are you kidding me? That doesn't, yes, it does really happen.
Yeah.
And why are all of these women who are so empowered, knocking it out of the park at home, knocking it out of the park if they work outside of the home, but they're shackled?
Exactly.
In terms of their sexuality, in terms of their ability to be enjoying life.
Exactly.
And we see that older women are marginalized. They're not even seen.
Yeah.
And this has been shown on repeated studies. They'll take a woman who's 60s, place her in a supermarket counter, and she's literally ignored.
Wow.
So why do we have this in terms of our sexuality also? Why are we letting ourselves be diminished when we're actually getting revved up and more in our prime. These are our queens. These are our leaders.
Exactly.
But all of a sudden, we're minimalizing them, and we're also taking apart what should be very full lives.
Yeah.
And this is why you and I bonded so quickly.
It is.
And even as a facial plastic surgeon, and why and when you ask how does this conversation come up, well, just offer a little entryway to it.
Yeah.
Be it, I'm fortunate, I have an Emsella chair sitting in one of my exam rooms.
Right.
So they walk in and they see this chair.
Yeah.
And then if you just take it a minute longer, and you open that door and you say, oh, yes, oh, well, life could really be great, or, yeah, I know, hair.
Yeah.
The second that you just say the word, wait a minute, this is a safe place for us to talk about this?
Yeah.
And you can change lives.
I'm going to go back to the 60-year-old woman. Medically speaking, there is no reason why we can't still have orgasms well into our 60s and 70s. Is that correct?
80s and 90s.
Okay. Can this keep on getting better? So just from a medical perspective, can it?
Yes.
I love knowing that.
Yes,
I love knowing that.
Absolutely. And I think one of the, blessed things that happens with age, though, I have a 20-year-old daughter, and even though this book says not your mother's orgasm book, it actually is her mother's orgasm book, and it should be for all mothers, because if we had that knowledge, if we had that comfortability with our sexuality, even at a younger age, why couldn't we be enjoying this? And definitely let us be empowered. Let us not have vaginal atrophy. Let us maintain that moisture, feel confident about how we look and we feel everywhere.
Absolutely.
So we can be enjoying sex as much as in our 30s. The extra arousal that we'll get maybe as our hormones change in our 40s and 50s as we approach menopause, but enjoying it as well into our 80s and 90s. I mean, we are living better. We want to enjoy lives fully, and to be really point blank, I mean, particularly as perhaps you are older and maybe your mobility isn't quite what it used to be. Well, there's a wonderful activity you can enjoy at home.
Absolutely, and they're good for our health. So do your patients ask about, let's say, clitoral stimulators, for example? So if you're talking about, orgasms are great for you, and they're like, gosh, I've never had one, I wouldn't even know where to start. Do you ever say, well, you know what? This is something that, a lot of other patients have tried and like. Do you ever do that? So
for you raised an interesting topic, is it has come up in conversation that a patient, she said she had never had an orgasm ever in her life. For patients like that, that's when I really do rely on my wonderful colleagues, both for two reasons. One, OBGYN, just to make sure that everything is okay.
Absolutely.
And also in the mental health support field.
Right.
Because if someone's never had an orgasm, even on their own, one does have to wonder, are there some psychological issues that maybe need to be addressed? God forbid, traumatic issues that could be prohibiting that. And sometimes, technology is wonderful. I say this all the time.
Yeah. Technology
can be great, but just because you have a hammer doesn't mean that everything is a nail.
Got it. I like that.
So definitely, I mean, women can have, and I think your question about asking about, clitoral orgasms is interesting. And perhaps maybe that's part of the reason why this capability has been, of a G-spot orgasm has been so taboo even to talk about, is because it's quote unquote harder to get a woman to orgasm than it is a man.
I fully disagree with that. I just fully disagree.
Well, I mean, just because it may seem intimidating because there's a lack of knowledge doesn't mean that it's quote unquote harder. It just means one just needs to explore safely.
Right.
And my job working so much with technology is, how that can give us a better life and maybe make those goals easier and more attainable.
Yeah, absolutely. Well, I love knowing that the things we've been doing to our faces are fully applicable to what I would call our pussies. And of course, people use all different words, all different monikers. And my goal, as you know, and why we're looking at this sign and why our mugs are here, is to normalize the word. And I feel like that about any of the monikers for pussy, all of them. I'm happy if they're all just as thrown around as easily as balls, right? Like I could be in a meeting and say, I've got the balls for the job, but right now I really couldn't go into that meeting and say, I've got the pussy for the job and expect the same reaction. So, what we're doing to our faces is totally accepted, right? Oh, I just got this laser treatment. Oh, I just got this thing. I got this. Oh, try this thing. I got six of these. Did this to my neck. What? All the stuff. I really hope that there is a shift in culture where, and that's why we're doing this podcast. Essentially, I want there to be a shift in culture so that it is not so taboo. So there is not that stigma.
I really hope that we are moving towards that. I really hope that, as you said, I have the balls to do the job. I have the pussy to do the job.
Yeah.
I really hope it comes to the time as, regardless of if you're a he, a she, a they, you are a human being who is capable of doing the job, and you are fully empowered, and each individual is fully empowered to the best of their abilities and enjoying life to the best of the abilities. So I will salute you and take a toast from my lovely mug here that says huge pussy on
Huge
it.
Pussy. With the correct definition on the back. The new definition, as we can see here, is
Resilient,
begins with orgasmic.
flexible,
Yes.
humanity vessel,
Yes.
And all of those things, life giver. So I really do hope that it is the change, because I personally love empowering my patients every single day.
Yeah.
And this should also be an area that they're empowered as well.
Definitely. Well, certainly the technology is changing, and I think that's so exciting. You're such an innovator in the field. You are a regular speaker and a key opinion leader. What is the technology that you're really excited about?
In the vaginal arena or everywhere?
I would say specifically in the vaginal arena, but then also, sure, why not everywhere?
Well, and this will probably clear up as to why a facial plastic surgeon is so involved and so knowledgeable about technologies that are being used everywhere throughout the body. So, I truly love Emsella and MFem. I think particularly this combination of using radio frequency and muscle stimulation can empower our own bodies to be the best that they can be. And we're not talking about invasive. We're not necessarily even replacing surgery. Surgery absolutely still has its place. The reason that I got involved with these specific technologies about 6 years ago is because we've applied them for the face. And that was my passion project, is the development of M-Face using radio frequency muscle stimulation to hold our faces back up.
So basically the same thing. Like if I did an M-Face treatment, what do? You put something on my face and it vibrates?
You're putting applicators on the face, and it is causing your muscles of your face to engage specific ones, because that's very also like pelvic anatomy, extremely complicated anatomy, to help reposition and hold your face back up, say the cheeks and brow. So for me, when we're talking about the combination of radio frequency and effective targeted muscle stimulation, that makes me incredibly happy, because it's just harnessing our own body's power to really kind of do physical rehab. And that's the same thing that Emsella is doing. Those Kegels are to rehab, or that's your PT to keep yourself in shape. I mean, it's like working out in the gym. It's like Emsculpt for the body. So I would have to say that these two devices, and the fact that the MFem treatment is now down to eight minutes.
That's amazing.
I love the earlier treatments as well. But we also have a CO2 laser, which we haven't touched on too much. But the CO2 laser has an adapter. We love that for resurfacing skin for the face.
Sure.
The CO2 laser can be used. There's a vaginal handpiece that can be used to also stimulate that collagen, elastin, increase blood flow for the vagina, kind of in a similar manner that we use the radio frequency. A little bit of downtime with that, though.
I was going to say, because when I think about CO2, I think about
downtime.
Nobody's seeing you for at least a week or so.
So no one would be seeing you in the vaginal area for about a week or so either, at least 5 days.
Would you be able to walk?
You can walk, absolutely.
Okay.
Absolutely, yeah. No, it's not nearly as probably gruesome as our listeners are thinking
right
now. It is not.
Okay.
but those, I think really are covering the technologies
Right.
of what we can be doing for using devices to improve our lives.
Why would I use the CO2? Would it be, again, to stimulate not necessarily the muscles, but more like this here?
Exactly. So that would be kind of, you could do CO2 or you could do radio frequency.
Got it.
And I suppose it depends a little bit on what your provider has and how much appetite you have for having some downtime.
Okay. And then also you mentioned, if you have, let's say, a metal device, you mentioned, or, a couple of other restrictions for this, would I have the same restrictions with CO2?
So for radio frequency, you would be restricted, but you could do the CO2 laser.
Okay, got it. So we have options.
So we have options, and that's
I love that.
why I have close to 60 devices in my office.
Okay.
Because not only I have the hammer, I have the screwdriver, it's a nail, it's a screwdriver, it's a screws, because everything, and I can't say that's going to be widely available to everybody throughout the entire country, but these devices are pretty widespread.
Right.
And at least some of it will be available somewhere with a provider near you.
I mean, I would hope so. I mean, you're based in New York and in Westchester.
Yes.
I would think I'm based in Los Angeles. If I did a Google search or if I asked you, you'd say, oh, you know what? So-and-so does it.
Yeah, absolutely. I
would think you, I'm sure, would know that it's widely available throughout the United States.
I think you're definitely going to be seeing it in all of these technologies are really widespread now.
Right.
I mean, you're going to be seeing these devices, large cities, small cities, and many of them will support the vaginal applications as well.
Okay.
So it's a matter of just finding a provider that you're comfortable with.
Yeah.
And who is listening to you.
So when are you writing a book?
If you're going to co-author it with me.
That sounds fun. It does sound fun. I think we'd start our intro with, within 3 minutes, we were talking about squirting.
Yes, absolutely.
And we knew
you too can squirt too. And if you haven't, you should.
I like it. You mentioned you have a daughter, correct?
I do.
And
and two sons.
And two sons. So do you talk with your kids about this stuff?
Much to their dismay.
Same here.
Let's say it again. My daughter is 20. My son just turned 18. They both have copies of this book and are going to be, maybe somewhat embarrassed. And you have to gauge. I mean, it's with everything that we talk about, how comfortable or uncomfortable they're going to be. Did I make sure they both have copies of this book? Yes. Did I sit down with them and go into detail? Not yet.
Right.
They
can read.
Yeah, they can read. They can read, and they don't have to read it now. They could read it in 5 years. But at some point, I think it's important education, and we need to educate everybody.
Absolutely.
Every generation.
Even you giving that book to your kids, or giving this book to your patients, or recommending it to your patients, all of those acts normalize it. All of those acts remove stigma. Because if you just give this to your kid, that's great. That gives them like the green light. This is acceptable. This is okay. I'm not going to be dirty or wrong or a deviant or anything else, or I need to, read it underneath my covers with a flashlight on because it's wrong. I also talk to my kids. I mean, I am the CEO of Huge Pussy, so, that you can only hide that for so long.
I can imagine.
And it's great. I think it's great. I mean, I think they would agree. My son is 27 now. My daughter's 17. And my feedback from them is generally they know that there's nothing that is taboo. So they know they can ask me anything. And they also, I think, will be out there in the world just knowing that whatever kind of thoughts they have are okay.
I think that is great, and it's empowering them to understand their own anatomy or the anatomy of their partner. So many of my patients come from all different backgrounds, and be it religious backgrounds, level of observance of religious backgrounds.
Yeah.
And this is something, whether they are married in a traditional relationship, in whatever sexual relationship, this is something that they can relate to. This is something that can improve their lives. And, you're talking about making it a normal conversation topic. And, perhaps some patients are going to take the book and they're going to walk down the street and they're going to wave a flag and look at this, everybody, what I can do.
Yeah.
But for patients who, come from a more conservative background, they too can relate to this and they too can benefit. And perhaps they're going to limit those conversations to being with their doctor.
Yeah.
But if they can be so empowered, as we're empowering our children, as we're empowering our next generation, we've done good.
Yeah, absolutely. I agree. And hopefully, people watching this and even hearing about it and even, not seeing like the little devices that we're looking at will take away from this, oh, okay, I have a better idea of what is available for these kinds of issues, whether it is incontinence or it is the loss of moisture, the dryness, or things around menopause, or the labia is too big and painful, or the labia is too big and I don't like the look of it. Whatever it is, it feels like, hey, there are things out there and they can be improved, whatever it is.
Absolutely. If you're in New York, come on by so you can try the Emsella.
I am like ready. I'm like, I want it all.
I'm going to see you tomorrow.
Yes.
I think you said it perfectly. I want it all.
I want it all. I do want it all.
Why can't we have it?
I believe we can. I believe that every day gets better. Truly, I feel like every day gets better as I've aged. I feel like I become happier, wiser, more orgasmic, more
joyous,
forgiving, more joyous. I could become more informed. So therefore, I hope I become more intelligent. I think I become more tolerant. And how do you feel? Do you feel like you have gotten better with age?
I completely agree. And it's not exclusive to men.
Right.
And all of us should be enjoying every stage of our lives.
Yeah. Let's talk about hair for a second, because you mentioned hair, and I know that's one of your specialties. And I've had 2 people extremely close to me had cancer, different kinds at the same time, lost their hair. And then, so that's from one perspective. Another is, I think I had 4 times the amount of hair when I was in high school. It was just like hair for days. I looked at a picture. I was like, where did all of that hair come from and where did it all go? I'm very happy because I've got hair, so fantastic.
Good.
But if, I lost half of my hair, all of my hair, or if my hair is just not as lush and whatever, what can I do?
So, and also when we look during the time of COVID, the second most Googleable search term for beauty was COVID hair loss. First was mask acne. Second was hair loss.
I had no idea.
So we are seeing it whether it's due to viral illness in general, or the hormonal changes that we start seeing even in our 30s. And people do ask me, we can touch on it too, what hair care products? Am I pulling my hair out? Extensions. So, the trifecta that could be causing hair loss and our hair to be thinning as we age. And as a facial plastic surgeon, hair, eyebrow hair, facial hair, hair on our scalp is absolutely a part of beauty. And there are many interventions that we can do to really help that. I mean, the first and foremost, and particularly with women, is just to see nutritionally, are you in the right spot? And metabolically, anemia, thyroid can all drastically affect hair. Huge decrease in weight. People talk a lot about Ozempic and those great medications that can really impact and improve the lives of people with diabetes, but also causes weight loss. Whenever you're having a huge shift in weight loss, you can also have hair loss. So what are some of the many things that you can do? There are medications that can be very helpful. Of course, there are more effective medications for men. Big surprise. Viagra works so great for men. Propecia works so great for men.
Not for women?
We don't see that as much with women. But if we can, there are a lot of vitamins that we can do. Just minoxidil, either in pill or topical form.
That's like Rogaine?
Rogaine is a commercially available topical.
Which is minoxidil?
Which is minoxidil. And there's also pill low-dose minoxidil. Can also really cost effective. Speak to everybody in the audience out there, speak to your local provider because they could prescribe that for you.
Your regular doctor too?
Your regular doctor could be prescribing
Maybe your gynecologist even?
Your gynecologist, absolutely.
Your facial plastic surgeon?
Your facial plastic surgeon can be your best friend.
There you go. Okay, that's interesting. I didn't know about that.
Absolutely. And eyebrow hair as well. I'm one of the few places that really does a tremendous amount of eyebrow transplants.
Interesting.
So we don't have to go into that twilight years, bald, hairless,
Great.
and dry, atrophied, and not enjoying sex. So we can be enjoying everything. And then, again, the surgical option still is always there.
So hair transplant.
We still have a hair transplant.
Okay.
That could be a possibility. We have a number of other interventions. There's a lot of cutting edge work being done.
Okay.
With things like PRP, platelet-rich plasma. That's what's in your whole area. We haven't even touched on, but I know with one of your future guests, you'll be touching on it.
Yes.
Is injections like the O-spot and the O-shot and the P-shot.
Exactly. We're having the inventor of the O-shot.
Wonderful.
So excited.
And so those PRP harnessing, again, the concept of harnessing the growth factors in your own blood. Exosomes is a new area that I've done some research on, and we're going to be seeing more and more.
So that is not using your own blood and spinning it.
Exosomes are the messenger RNA and growth factors, little packages, little messenger packages.
They sound cute.
That's stem
I like their
cells.
Okay.
I'll give you some exosomes.
Okay.
That stem cells release. So the FDA is working with a number of companies on some indications. So that is going to be interesting. And there's some that are available with using topically with microneedling. So the future is bright. It's not just technology. There's a lot of other scientific advancements. And again, just finding the right provider. Hopefully in an area near you, will be able to bring these newer technologies. Now, all of them I don't think are going to be available everywhere.
Right.
But we are, and through all the articles I write and speaking and you doing these amazing podcasts, we're doing our best to really educate everyone to what science can do for us.
That's really exciting. Really exciting. To me, this is so informative and very uplifting as well to know there are so many options out there and to know that they are readily available all over our country for sure, it sounds like to me. And, not just one thing, but, the inner, the outer, it's all there. That's exciting. It's really exciting. Thank you so much for taking time out of your incredibly busy schedule. Truly, I know how busy you are. Just a little bit. I know how busy you are.
It's a little hard to get me on the phone. A little bit. But I'm available. I'm always available.
But I really do thank you for taking this time. You're such an expert, and your knowledge of the technology is, phenomenal. And I love how we can just kind of take the time to demystify it. And I also love how you are destigmatizing female sexuality. It's incredible.
It's part of our strength, and we're lucky to be women. So
we are so lucky to be women. That is how I feel every day. Truly. I'm like, thank God I have a pussy. Thank you. Thank you, God. Thank you, universe. Thank you, whomever it is I'm thanking. And speaking of, I would love to give you this huge pussy tote. And I will be sending you the mug, but also the tote, because the tote does have the new definition, otherworldly, orgasmic, resilient, flexible, life-giving humanity vessel. And this is kind of our new mini tote.
I love it. I love it.
I think my scarf is in it, so I'll get that out. I wanted it to look a little bit full. So remind me on that.
I love it.
Well, wear it well, and do not be surprised if you get stopped in the street.
No, I hope we get applaud.
I've gotten applauded. Absolutely.
All right, excellent.
Yeah,
no, this is great because I was going to steal your mug, so I'm happy to have this.
Yeah.
So
well, we will have all of your where to find you, everything in the show notes.
Well, you can follow us. The easiest is just to follow us at Instagram. It's DRHALAAS.
DRHALAAS.
Correct.
So Dr. Halaas.
Correct.
First name Yael. How did I do with that pronunciation?
Beautiful.
I'm so glad. It is a beautiful name.
Thank you.
It really is.
Thank you.
Your heritage?
I am actually Cuban Argentine. The last name is Norwegian, and the first name or could also be Arabic, and the first name is from the Book of Judges. Actually, Google the story of Yael. Talk about female empowerment.
Ooh, I love that.
Yeah.
Yes, please. Okay, on that note, I think I will be doing that. I'm doing a little Bible reading too.
Okay, good. Book of Judges.
I'm going to read this. I'm going to read all about ejaculation, and then I'm going to do a little Bible reading.
Right. I'll tell you this. She slays it.
Oh, yes, please. I love that. Thank you so much. And I can't wait to come see you in your office because I am taking you up on that. I will be there.
Everyone should be there.
Everyone should be there. I'm picturing these like Emsellas.
We've got the chair of marvels going on.
Like I'm picturing
Absolutely.
like knitting circles. I'm picturing like, book clubs. And instead of just sitting in chairs, we're sitting in Emsellas.
I mean, absolutely.
I mean, doesn't that sound like fun?
I mean, talk about. I mean, I'll multitask. I'll sit on the Emsella with my computer in front of me.
Right.
I mean, if I can, I'll do an office meeting.
I want to sit on it and like chat with other people and just like talk to them about their experiences.
All right, stay tuned for another podcast from my office. We will be.
I love that.
Well, definitely
live from Park Avenue.
We will put it on. We'll definitely put it on Instagram.
Wouldn't that be so
that people
fun?
can see, or
Okay. I think that's a
hopefully
great idea.
get you a device here to share on future podcasts.
Perfect. Well, here we come. I'm popping over.
You hear that? Here we come.
Here we come.
Literally.
It's going to get wet. Thank you, Ian. Thank you so much.
No, my pleasure.
So fun. You're so fun. Like, let's do this every week. Let's get the book done.
I'm game. Come on, everybody. Come on down.
I'm Jacqueline Buckingham. Welcome to your most powerful chapter. Wherever you are on the pause spectrum, this is where you begin. Go to joinmeno.com and get early access. These are the answers, and we bring you the experts that have them.